we need to be much more transparent about quality metrics. Are we meeting the various metrics that we need to be meeting? And some of them are pretty simple, but others, you know, are fairly major. We're going to be looking, and certainly the federal government is going to be looking much more closely at outcomes, at morbidity and mortality. In terms of the patient sharing in the cost or knowing the cost, you know, there are very few other things in society where some third party is paying and you as the consumer really don't have to be concerned because, quote, someone else is paying. Now maybe that's okay when you're a kid, you know, and your parents are paying, you don't have to worry about the cost. But as an adult, when you know somebody else is paying, you're not really concerned about what it's costing. There's no question in my mind that if patients see what some of these costs are, people will be much more selective as to how they make a decision. For that matter, if some of that cost is put onto them, they'll be very selective and discriminating as to what they choose to do. So for instance, somebody comes in and there's a question as to whether or not they should have an MRI scan. But the evidence really suggests that you don't need an MR for this particular situation. Right now, it's not uncommon to have patients insist on getting an MRI. If you tell them they're going to be responsible for the $3,000 or whatever it may be, some people would be very selective as to whether or not they want to have that procedure done, especially when it's explained to them that it's really not going to change the treatment. Physicians have by and large resisted being told how to practice, which means treatment protocols, and yet if we're going to control the cost of care, people are really going to have to practice according to some sorts of guidelines, whether or not they're required or not, especially as we start looking at some comparative effectiveness and recognizing that there is evidence to show what is beneficial, what isn't beneficial. Decisions are going to have to be made based on the evidence, and this whole issue of evidence-based practice makes a lot of sense. We don't have great evidence for everything, but there are a number of conditions where we do have good evidence, and where that exists, it really should be utilized. And I think people will make much more judicious decisions when they are aware of the cost, when it's not just somebody else paying, when they do have some share in the cost. And people are seeing that now at their employment. You know, employers are seeing rises of 5 to 10% in their health care costs each year, and more of that's being passed on to the patient. Patients can be given a choice. You can choose to have a little less choice but pay less, or you can have, you know, whatever choice you want, but you're going to pay more. Most people would choose to put more money in their pocket when all is said and done, especially if the choice is not so limiting that they can't get everything with some limitation of their choice.